Hello, everyone. Today we're going to be talking about something very important, and that is dental health. It's something that matters to all of us. I'm Fatima Muhammad, and I'm excited to be your host for this live show. We've got a great show lined up. We will be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry, how to keep your teeth healthy, and ways to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask more questions during the show. So before we start, let me tell you a little bit more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in the Dallas-Fort Worth area in Texas. And guess what? He's even got a book that he's writing that's coming out next year. But if you want to know more about Dr. V, you can check out our website at www.mytoothhq.com. So let's get comfortable, relaxed, and ready to learn lots of cool stuff about taking care of your teeth. Let's begin with our dental live show. Welcome, everyone. And now let's welcome Dr. V and start our show.
Wow, wow, wow. That's awesome, awesome, awesome. Very good, very good. Hi, everyone. I'm Dr. Kumar Vadivel, but you can call me Dr. V. I'm really excited to be here with you all today. Another great show lined up. And let me tell you a little bit about myself. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones and the support of your teeth. I'm also skilled in dental implants and oral surgery. I'm part of the American Academy of Periodontology. This is a fancy way of saying that I work with a group of dentists who are experts in gum health and dental implants. I started ToothHQ Dental Specialist, and we have four offices, as you guys know, in the Dallas-Fort Worth area. We are all about making sure that your teeth and gums are healthy and strong, and they are going to last for a lifetime. Now, I'm here for you. I would love to hear any questions you might have about your teeth and gums. You can ask questions live here right now, or even send them in for our next show. Your questions help us make these shows really helpful for not just for you, for everybody around the globe. Think of everyone, right? And one more thing, if you like if you like what you're learning here, please let us know. We need some pat on the back, right? So your feedback is super important to us, and don't forget to like, of course, and subscribe to our channel so you won't miss out on our latest updates and greatest updates and helpful tips on for your dental health. So I'm looking forward to another great show, talking with you all, answering any questions you may have. Let's make our smiles the best they can be, right? So let's get started. Right?
All right.
Okay, great.
Okay. All right. So, our first question of the night is I had radiation therapy in my jaw area 3 years ago, and now I'm planning to get dental implants for two teeth. Will the radiation treatment affect the success of the implants?
So it's a great question about the radiation and the effect of radiation on the dental implants. So not everyone who had radiation are candidates for dental implants. It really depends on the amount of radiation that you had and which part of the body that you had radiation. Of course, if you had radiation and the other parts of the body, let's say somebody had kidney cancer or somebody had breast cancer, and it's not as big of a problem as opposed to anything proximal, meaning, like, let's say you had a head or neck cancer. If you have neck cancer and then if you have radiation, you may have maybe a little bit more risky to get the dental implant. But if you, let's say you had jaw cancer or tongue cancer, when the radiation was passed directly onto the jawbone, and you may have a little bit more risk as compared to the other people. Sometimes, depending on the amount of radiation, if it passed directly onto the jawbone or the facial area, you may not ever be a candidate for a dental implant. So the best thing is talk to your oncologist, and or better yet, like you talk to the oral surgeon and have them talk to the oncologist, and then they will be able to coordinate the care for you, and then whether you are a good candidate for implant or not, depending on the type and the level of radiation and the area of radiation that you had.
Okay, that's some good information to know. All right, we're going to go to the next question. Is it possible to have periodontal disease without any infection, primarily caused by mild occlusion and brushing too hard? If these issues are corrected, will the periodontitis resolve on its own?
So um, it is not uncommon for you to have what we call it as a malocclusion, or a bad bite, or like a not the best bite you could ever have, or just just simply saying that crooked teeth. So when you have crooked teeth, the teeth, they don't come together well. So for example, when you bite down, you may be just knocking on one tooth more than the other. So when that happens, so what tends to happen is you keep slamming on the tooth like this, and then that tends to cause bone loss around the tooth. Matter of fact, like when we were teaching a class last night, and we were talking about how one of the most common things get unnoticed is the bite that causes the periodontal disease, or gum disease. And the second part is brushing too hard. Will that affect periodontal disease, or will that cause periodontal disease, or have an effect on your gum? Absolutely. Brushing hard too hard, when you totally keep brushing too hard or scrubbing your teeth so hard, when you pull the gum away, or when you make the gums kind of recede more, then that pulls the gum tissue down, or you lose some of the thick gum tissue. When that happens, then you become more prone to getting periodontal disease or gum disease. So that will affect your gums also, or that will make you prone for getting gum disease. um, Whether you can completely resolve by stopping brushing too hard, you can't resolve that, because the damage you create is pretty much done. But once the damage is created, once you fix it, then possibly it will get better. And then the speaking of the crooked teeth causing gum disease, when you have crooked teeth, when you have gum disease or possible gum disease caused by crooked teeth, either the bite can be corrected either via braces, or what we call it as an occlusal adjustment or a bite adjustment in our office. When you're slamming your teeth like this with let's say this at the top, and then you keep slamming with the bottom teeth. Once we do the bite adjustment, when they are not touching as badly, then things tend to get better, and the periodontal disease may not completely resolve, but you can get them under control.
Cool, cool. All right. And that's probably why they say use a soft toothbrush.
You got it. You got it. Yeah. At least a medium, right?
Yeah,
At
a
least a
medium or
medium.
soft, but not the hard
Absolutely.
ones.
Correct. Yeah. Right.
Okay. All right. Our next question is, it says, "Hello, doctor. I had two root canals on my lower back teeth, one on each side. Neither tooth received a crown afterwards. And when I asked my dentist about it, they said that I didn't need one. Within a year, one of the teeth broke and now is beyond saving, requiring extraction. I feel that a crown should have been placed, and now I'm losing a tooth that's important for proper chewing and digestion. Sorry. My dentist seemed dismissive and didn't offer a suitable replacement option other than a denture, which I do not want. I feel very frustrated and upset about how this was handled. What should I do next? How should I address the issue with my specialist?"
Well, it's a two-part question here. Number one, do you need a crown after a root canal tooth? Particularly when it is a back tooth, more than likely not, no questions asked, you always are going to need a crown after getting a a root canal on the back teeth, starting what we call it as the premolars or definitely the molars, you are going to need a crown. Otherwise, you're going to end up damaging, or the teeth are going to get crumbly over a period of time. Of course, if it is a front teeth, more than likely not, like you may get away with not having to have a crown. So first thing, and I can't really tell you like how you got the advice or who told you you don't need to have a crown. But most of the recommendation is, you could have had a crown that possibly could have prevented you from having to have this tooth damaged. But going back to now, you got a damaged tooth. How do you replace that? So the best possible recommendation is, of course, we always recommend you get a dental implant, so you don't have to touch the two teeth on either side to do a bridge, or whether you get a partial denture like the way that you are saying. That partial denture is not the only option. Many patients, particularly when it comes to the back teeth, they do not like putting in a partial denture, which is a one tooth like this, like the real plasticky, but then a big chunk of either a pink plastic, or like sometime a metal bar goes around the whole of the inside of the lower jaw. Most patients do not like it at all, or even if they end up getting one, they do not ever wear a partial denture. So partial denture is not the only option. Again, sometimes we say, oh, you don't have to do anything about it, but sounds like you already made up your mind, you want to do something about it. So my recommendation is, talk to your specialist or even your dentist again. Ask them why did they recommend against going for a dental implant or any other option other than the partial denture, and they should be able to help you, either your dentist or your specialist.
Okay.
Great.
All right. Moving on to our next question. Which method is more effective for cleaning your tongue? Using a tongue scraper or brushing it?
Um, Tongue scraper or a toothbrush, they are both as effective as they could be. It's funny, like, I'm in the office like during the day. After I have my lunch, I usually go to the bathroom and I use my toothbrush, and I just scrape the tongue. And even when I'm home, I exclusively do not use a tongue scraper, and I usually use the toothbrush. So doing the toothbrush is as effective as Fatima said earlier. If you are using a soft toothbrush, and it may not be possible to get everything out of your tongue, but if you are using either a medium or a hard toothbrush, which we don't recommend using a hard toothbrush, but if you do end up using it exclusively for the tongue cleaning, great. So whenever you're using a medium or hard toothbrush, absolutely not a problem at all. You can use them to clean your tongue. And if you have a tongue scraper, absolutely, you can use that also to use the tongue scraper. There are several forms of tongue scrapers available, so go to Amazon or like any other store that you go to, walk down the aisle, we always say. And if you see like a couple of types of or brands of tongue scraper, buy a couple. They are like $1 or $2. Just buy a couple, and see which one you like, and then compare it with the toothbrush, and then see which one you like. And we always say, hey, I'm not going to force you to use a tool, and find the one that you like. So you're going to continue to use it. So you don't feel like we are forcing you to use something. So find something that you like when you walk down the aisle at your store tomorrow, or buy something from online.
All right. I personally use both. So, our next one is, my neighbor rinses his toothbrush with hot water once a week. Is this really necessary?
Um, yes or no is the answer. Do you have to, like, it's kind of like, imagine, right? If you are a new mom, or if you are a mom, when you're using, what do we call those bottles that we feed kiddos with?
The
The bottles, right?
yeah,
The
just a
bottles,
regular
yeah.
bottle.
The
Yeah.
regular bottles, right? So when you feed them milk, then after you wash them like a few times, with the cold water, but then after like a few times, and then you put them in the hot water to boil them, right? But you don't want to never ever boil a brush and then everything is going to melt. You don't want to boil, but once in a while, can you dip it under? Can you dip it under the hot water or run it under the hot water to clean it? Absolutely fine. Sometime, we always say, like, after any type of, sometime when patients are getting surgical procedures done, we tell them, hey, just soak the toothbrush under the hot water to make the bristles kind of like softer. So can you do it? Absolutely, you can do it. Are there like real benefits to it? Probably not. So you can decide. And one of the reasons, one where your neighbor may be saying that, is they may be thinking that by soaking the toothbrush under the hot water, they think that they may be killing the germs away. But unless you keep them there like for a long period of time, or unless you boil, like the bottle that we talked about, like when you're using it for the babies, right? You're not going to be able to really kill the germs. But if that is going to make you emotionally like feel a little better by soaking it under the hot water, just go for it. Just do it. We say go Nike,
Go
right?
Nike.
Just do it.
Just do it.
Yeah.
All right. Our next question is, I had a tooth extraction. Is it normal for the bottom of the socket to look white? I wasn't given a syringe, so I'm unsure if this is part of the healing process or if it's just food.
Um, the the bottom of the socket looks white. It is not uncommon for you to have anytime the healing happens, the gum tissue is just going to look either gray or white. Imagine, right? So when you have a nail bed, or when you probably did the nail, kind of like when you go to the nail salon, you just got the nail done. When you soak your hand in water, or you stay in the bathtub for a while, then you're going to start to see the nail bed kind of getting white. That's exactly what happens in the mouth when you have any type of procedures done. When the gums are healing, then because it's always soaked with saliva in the mouth, they're going to start to look white or gray. And particularly, it's what we call it as a baby gum. So when the gums are healing, we call them baby gums, and they are going to look white or gray. There is nothing abnormal about it, like unless you are having any type of high fever or bad breath or a dry socket, there is nothing for you to be concerned about. And you said, like, I was not given a syringe, like, whether to clean it. um, so if you are not given a syringe, and if it is during the first week of the healing, a lot of times when we do not give you a syringe, because we don't want you to unnecessarily use the syringe during the first week of the healing period, then you end up dislodging the blood clot, which is going to cause the dry socket. So we won't necessarily give you the syringe. But after the first week or the second week, when you go back to your surgeon or your dentist, ask them a syringe is appropriate for you. And then sometime, as we do in our office, right?
Yeah.
So what do you do when they come back?
We show them how to use the syringe.
Bingo, right?
And we actually clean out some of it.
You clean out, right?
Yep.
So that is exactly what you do. So when they come back for the follow-up, we clean out the socket, we use the syringe, use a mouthwash to kind of flush it out, clean it out, and we show them with the mirror how to use it, and then they take it home, and then we don't see them back for a follow-up. They heal great.
They heal pretty good.
Awesome.
Yeah.
Awesome.
All right.
Okay.
All right.
Perfect.
All right. We have time for one more question. All right. I had my wisdom tooth removed 10 days ago, and there was a gum flap partially covering it while the socket is healing. I've noticed the gum flap is slowly turning white. Should I be concerned, or is this just a sign that the tissue is dying?
It's almost the same question as the last one, right? So it is part and parcel of the healing. So anytime you see something white or something grayish, it's always, like we always say, a gray is good, right? What that means is, what we call it as a granulation tissue, or like the baby gum tissue that is healing. And because when it is wet always inside the mouth, and that's when you start to see that, just kind of looking grayish or like whitish, which is not uncommon at all. again, as I said earlier, as long as you don't have any signs of infection, such as extreme discomfort or drainage from the area, or you're not able to sleep well, or you have a dry socket, then you don't have to be worried or concerned about the gum flap looking white or grayish, and you should be fine. Again, if you're concerned, talk to your dentist or the surgeon, and they should be able to help you.
All right, we're going to do some live questions. All right, let me pull them up. Okay, so the first live question is, my daughter is 13 years old. We recently had her upper front baby tooth removed because it wasn't falling out on its own. Even though many of her friends had lost theirs at a much younger age, it's been 6 months and I still don't see any sign of a new tooth coming in that area. When the dentist checked with an x-ray, they said it might take some more time. She's feeling very unconfident about going to school and I'm feeling helpless. Is there any way to speed up the process of tooth eruption?
Fantastic question. Sounds like you probably have either you done your research or you probably read about it, or yeah, you talked to somebody. So whatever you asked me, and you pretty much kind of answered, right? So can anything be done? What we do in our office is what we call it as an exposure and bonding. So particularly when the kid is not comfortable with what is happening, and if we want to expedite what we call it as the eruption process, we call it as a forced eruption. So we want to force the tooth to come into the mouth. A lot of times it could be as simple as, like, let's say, imagine the tooth wants to come down and you have a bunch of gum sitting over upon the top. It could be as simple as we make a small kind of incision, or like a small, like we trim the gum just pretty much kind of like like a peekaboo, right? So we make a small incision, kind of peek inside and let the gum kind of open, and the tooth is going to start to come through. Sometime what happens is, and you may have some gum and maybe some bone around the tooth that's not allowing for the gum to come out, to the tooth to come out. So in those cases, what we do is, again, we play the peekaboo, peek under the gum line, and then we trim some bone around them, and then we also attach a device. And what the device is going to do, and we are going to attach the device to the existing braces, and the orthodontist or the brace specialist, they are going to use that to pull the tooth down. That's pretty much it. So again, talk to your orthodontist or your dentist, and they should be able to talk to you about whether you are a good candidate for what we call it as an exposure and bond process, and they should be able to help you.
Cool.
How many we do?
A lot.
Right. Yeah, that's exactly right. Yeah.
Yeah.
That's what we do. So if you
Yes.
happen to be in the Dallas-Fort Worth area, come see us and we'll be happy to help you.
We will get you taken care of for sure.
Thank you.
All right, so we'll come back to the live questions here in a little bit. Our next question is, which dental conditions have the potential to become life-threatening?
Gosh, man, it's a long question, right? It could be as simple as a fractured tooth getting infected, or you have some pus formation from an infected root canal, or you left the wisdom tooth impacted and that caused like a lot of damage and it caused a big pus pocket, and you have a high degree of fever. So anything that is hurting in your mouth, or anything that is causing discomfort in your mouth, anything that is causing any type of bleeding, or anything that you feel it is abnormal, that does not feel normal to you, that could be like a sign of infection. Any type of infection, you may be thinking, oh, it is small, not a big deal, but you don't know the degree or the extensity of the infection. One of the things that we normally tell or teach all our patients or educate all our patients is what we call it as a mouth-body connection. What the mouth-body connection means, like anytime you have infection in the mouth and the infection gets right into your carotid, and it goes into your carotid and goes into your heart. From there, it goes into your lungs, kidneys, pancreas, and all the way even to the brain. That is why things get tricky and it becomes life-threatening. So Do not ignore any signs of infection, anything that does not feel normal to you. Talk to your dentist or your dental specialist, and they should be able to help you.
So y'all heard that. If something doesn't feel normal, it doesn't look normal, if you're in any pain, call your dentist or call us. You can call us, okay? We will get you taken care of.
Awesome, awesome.
All right, we're going to move on to the next question. How quickly does periodontal disease progress in a 24-year-old male?
What do you think?
Well, they're younger, so it probably doesn't progress as fast as someone older, or is it vice versa?
What do you think if what if they're a smoker,
Oh yeah, so smoking may play an effect on it. So it may
right?
have different factors in it.
What if
Different.
they are medically compromised?
Oh yeah, or like on medication or something.
Yeah, right?
Yeah. Yeah,
Right?
that does make sense. Yeah, you're right. You're
Right?
right.
So, irrespective of the age is the question, right? And then depending on their bite, whether they brush their teeth properly, they floss their teeth properly. So multiple things, and just like you said earlier, right? So
Yeah.
you could be a 24-year-old and then you have the most extensive gum disease, and you could be 100-year-old, and we see patients with 100-year-old, and they got a complete set of teeth, right? And
Yeah.
my dad like is a great example. He was 87 years old, and he had all his teeth when he passed away, so he had a complete set of teeth. So he's a great example. And so you can have a complete set of teeth and you may be older and you have no problems at all. On the contrary, you may be young and you may be smoking, or you may not be taking care of your good teeth, and you may have the worst periodontal disease or the gum disease. So age is no bar when it comes to periodontal disease. So the best is like you go check it out with your dentist or your periodontal specialist or the gum specialist, whether you do have gum disease or not. Better yet, you know what? You can self-diagnose yourself. What are the signs and um, symptoms of gum disease? Bleeding, bad breath, loose teeth, and long teeth, and something doesn't feel right, and you have pain on the gums, and you the teeth are starting to get loose. So these are all the signs of gum disease. So find out yourself. Yeah.
All right.
Awesome.
What are the health and anesthetic consequences of extracting 4 teeth for orthodontic treatment in my 15-year-old son?
Um, this is one of the most common questions, as a mom or a dad or a family. I'm sure you guys are always concerned about, oh, should I be extracting a good tooth? That is the number one question. Or should I be extracting all 4 teeth at the same time? This happened just like on Friday. So not just 4 teeth, we actually had to remove 8 teeth because the kid needed to have the wisdom teeth taken out also at the same time. Not just that, also the kid had an impacted tooth here, and the kid needed to have what we call it as an exposure and bonding done. Is it a lot? I'm sure you may be thinking that it is a lot, but for us, this is kind of a common thing that we do on a very regular basis. So going back to your question, to remove the 4 teeth, is it uncommon? Absolutely not uncommon at all. We do it all day long, and this is not uncommon. And guess what? Like, we are working on a mission with you to help you or help your kid achieve a great smile. One of the best ways the orthodontists are working with us surgeons to give you the smile that you need is to get those 4 teeth taken out. Guess what? Like we said when we started the show earlier, we want to keep you smiling all day long, all year long, right? And we want to keep your kids keep smiling all day long, all year long, all their life long. And this is one of the ways we do help the kids to remove the teeth on time. They can get the braces on time, and they can keep smiling.
Yeah,
How does that sound?
We want them to keep smiling.
You got it.
All right, so we are going to start our rapid fire questions. Now, Dr. V, you have to remember you can only answer in 1 to 2 sentences. So 1 to 2 sentences, and that's
Okay,
it.
are you saying that I keep talking a lot?
I'm not.
Okay. All right.
I'm
Okay,
not
man.
saying it.
I'll try, man. I'll try.
All right.
I'll keep it short and sweet.
It's
How about that?
simple and short, sweet. Okay.
So if you guys come to our seminars, we say kiss. Kiss means keep it super simple. Okay,
Yeah.
so I'll try to kiss it. How about
Okay.
that?
All
Right?
right.
Okay, cool,
Kiss
man.
it. Remember.
Yes.
All
Yeah.
right. So our first question is a bone graft necessary for everyone who gets dental implants?
Absolutely yes is the answer. Whether you're getting an implant or getting a tooth removed, we always recommend getting the bone graft, and there are multiple reasons why we do that, and we would love to tell you more about it. And when you come visit us at
Yes, so come
ToothHQ.
visit us and we'll give you in depth
Awesome.
more information.
Yeah.
All right. Does bruxism damage gums?
Absolutely, it does, and it does a lot of damage to the gum. It causes gum recession, gum inflammation, mobility of the teeth, meaning like teeth, making the teeth mobile, and also causes periodontal pocketing or periodontal disease or gum disease.
Okay. Can hypodontia affect speech?
So, I'm sorry, I'm going to make it a little bit longer.
Okay.
A little teeny
All right,
bit
we might do
longer.
3 sentences.
All right, okay, all right. So I would like to say what hypodontia means, because I don't want you guys to go clueless. Hypodontia means, you got less teeth than anybody else, somebody else, right? So is that going to, is having less teeth or hypodontia is going to affect your speech? Absolutely. It really depends on the number and the location of the missing teeth. If you have more missing teeth, yes, it is going to. And if you are going to have missing teeth in the front, it may affect you more than on the back teeth. Depends on your age, and it depends on the individual adaptability. So if you're able to adapt better, it's great. If not, then it is going to make you worse.
Okay. Now you might have to explain this one as well to them. Is Lanap an effective treatment option for pre-implantitis?
So what the caller is asking is whether the laser procedure, LANAP, is a type of laser procedure that we offer for the treatment of gum disease. What they are asking is the LANAP procedure or the laser procedure effective, or it's a treatment option for treating gum disease around the implant? Absolutely. The answer is yes. When you have gum disease around the implant, yes, the laser is effective, and we don't call it LANAP, we call it LAPIP. What that means is laser assisted peri-implantitis procedure. LAPIP. That's what we do.
Okay.
Awesome.
All right. One more rapid question, guys. Are gum grafts effective in preventing future gum recession?
Absolutely, they are. They help you reinforce and protect the gum tissue. They help you with covering the root of the damaged root, like what we call it as a root coverage. And also, they kind of help stabilize. I kind of say that it's kind of like the collar, the turtleneck, right? So it kind of keeps the neck, around the neck of the tooth, keeps your gum stronger.
Oh, okay. I
Yeah.
learned something new today.
Awesome, awesome.
All right. So our next question is, it says, "Hi, Dr. V. I'm 50 years old and missing my lower right molars. I'm considering getting implants to replace them, but I'm concerned about what might happen if I lose all my teeth in the next 10 years and need dentures. Would the implants have to be removed in that case? Could you please help me understand the implications?"
Um, you don't have to worry about like your age. Absolutely not at all. And then the great thing about the implants is, anytime you lose a tooth, and you are going to get an implant. It used to be, oh, if you have missing teeth, oh, come see us and we can do implant. But now the culture has changed. Anytime you are going to miss a tooth, we can give you implants. So what that means is, you can have two teeth that you are going to miss now. You can get implants, and if you need a couple more, then you can do them later. Or if you are going to have two implants here, and then you are going to end up losing all your teeth on the other side, then you can always add more implants. So adding implants in increments, it's absolutely not a problem. Again, anytime you are going to miss a tooth, always think of an implant and talk to your dentist and your specialist, and they should be able to help you, just like we do in our office, right?
Yep.
When they have a need to have a tooth removed, we remove the tooth, place the implant, do the bone graft, and give them the tooth on the same day. All happens on the same day.
Yep. One stop shop.
Bingo, right? No, one stop shop is us, but one and done.
One and done. Yeah,
One and done.
done.
One and done. Yeah, right.
All right. Hi, my daughter is 16 years old, and she's 16 years old and has an anxious nature. She is currently undergoing therapy. Sometimes when she eats crunchy items, she complains of jaw pain. Should I wait for her mental health to improve, considering the issues might be related, or should I consult a specific type of dentist?
Um, we call this a holistic care, right? So anything and everything in the body is connected. As you guys know, mouth is the gateway for your health, right? So is mental health is connected to the jaw pain. It's kind of like, the chicken or the egg story, right? Whether the chicken or the egg, and whether the jaw pain caused her to clench her teeth, and that is causing headache, and that caused the mental problems, or the behavioral problems, or because of the behavioral problems now she is clenching her teeth, and that is what is causing the jaw pain, right? We talked about this earlier. Go Nike, just do it, right? Why wait, to get something simply done? So one of the easiest ways to stop your clenching and grinding is to get a night guard. Talk to your dentist and get the night guard. You don't have to worry about, oh, is this connected or that is connected or not. Do something simple. And we say in medicine, common things are common. We know that the jaw pain could be related to other behavioral issues, and you don't want to even think about it. And this is very easy to handle. Get the night guard, the occlusal guard, and be done with it.
All right.
Hmm.
I'm 30 years old and I get dental cleanings once a year. I regularly rinse my mouth and do everything I can do to maintain good oral hygiene, but I still often experience bad breath, which affects my confidence when meeting people. Could you guide me on what else I can do to get rid of it?
Man, bad breath. Multiple reasons, right? It could be a variety of reasons you're going to have bad breath. Either you have dental plaque, or you have gum disease, or you have dry mouth, or you're using a mouthwash with alcohol that makes your mouth dry, or you're using some medications that making your mouth dry, or you're drinking alcohol that makes your mouth dry, or you could be having some kind of like a gastrointestinal issues, and that is causing the bad breath. So there are multiple reasons to why you could be getting the bad breath. So we say in medicine, or we say in our life, a process of elimination, right? If you have gum disease, again going back to what we talked about earlier, common things are common. So when you have gum disease, the first thing that I'm going to say is, hey, treat your gum disease, which is an easy fix. Then we will talk about, okay, hey, do you have dry mouth? Yes, we'll treat your dry mouth. And if you treat your gum disease and your dry mouth, and hey, could any type of habits, for example, smoking, or using a certain type of spicy food, or eating, drinking alcohol, so then fix the habit. Then last comes to what we call it as the digestive issues. So either we work with you, or we work with a physician to help you take care of the comprehensive approach to the problem, right?
Yeah, so it's kind of like a process of elimination almost. Just
Mm-hmm.
go down the list and
Go down the list,
yeah.
and then go Nike.
Go Nike, just do it.
Just do it, right?
Just
Yeah.
do it. All right. So we're going to jump back into our live questions. All right. So our second live question says, does ToothHQ's complimentary consultation for National Gum Care Month in September 2024 include a comprehensive gum exam?
Yes, it does, is the answer. And most of you guys know that we offer a free consultation and a free CAT scan. And particularly this month being the Gum Health Month, we are absolutely going to offer a complimentary gum screening also. So come see us at Tooth HQ. We will offer you a free consultation, a free CAT scan to evaluate your gums, and then also offer the gum screening also to see whether you have periodontal disease or gum disease to help you with how we can help you improve your gum health.
Good stuff. So
Mhm.
again, I'm going to keep emphasizing this. Come see us. We will get
If
you
you
taken
are
care
in the
of.
Dallas Fort Worth area, absolutely, there is no excuse for you to not come see us. And how many locations we have?
We have 4 locations.
Where
So,
are they?
Cedar Hill, Carrollton, Grapevine, and Mockingbird, SMU.
In Dallas.
In Dallas,
Okay?
yes.
So come see us. We are happy to help you anytime.
Yes. All right.
And of course, you're going to see the smiling face, and depending on which location she's going to be. Okay? So
Yes.
now she is becoming a superstar now. So I have to watch her now. So people are asking, okay, oh, can I kiss and I go see the superstar? Okay, so I should say rising star, right? Yeah. Okay.
Yes. All right. I have slightly crooked teeth and I don't want braces or aligners. Are veneers a good option for misaligned teeth to provide a better smile?
Veneers are they a good option? Absolutely, they are a good option. Are they the best option? Probably not. Again, I can't tell you depending on I wish I could look into your mouth and answer your question, but obviously I can't, right? So uh, the best option we recommend, before the aligner time, right? Like maybe let's about 20 years ago. Veneers used to be so popular. So we used to do them because people did not like putting in, we call it as the metal industry in the mouth, right? Because when you wear braces, and particularly adults, they don't want to put the metal industry in their mouth, so they don't like it. Nowadays, with the advent of technology, you have these clear aligners. Veneers are, of course, they are still popular, but people do more aligners as opposed to the veneers. But are you a good candidate for veneers and you want to skip the clear braces or the aligners, and you want to go to the veneers? Absolutely. Again, talk to your dentist and see whether you're a good candidate or not.
All right.
Mm-hmm.
It's day 2 after my wisdom tooth extraction, and I'm experiencing a lot of sensitivity in my lower teeth, along with a horrible taste and odor at the extraction site. I'm still in a lot of pain. Is this normal?
So it is a two-part problem here. One is the pain and the other one is the sensitivity. So particularly if you are on the second day, and it's not uncommon for you to get what we call it as a dry socket, because the blood clot from the socket comes out or dislodged from the socket, that causes what we call it as a dry socket. Particularly that happens at the first 24 to 48 hours mark. Particularly, it's not uncommon if you are a smoker, or if you are a female, then you are taking birth control pills. It's not uncommon for that to happen. So if you have pain and if that happened within the first 24 to 48 hours, talk to the dentist to see whether you have a dry socket or not, and they should be able to recommend whatever treatment they are going to. However, the second part of the question, you said sensitivity. So it's not uncommon for you to have sensitivity after the wisdom tooth removal, because what happens is, like, a part of the tooth, not the wisdom tooth, the tooth in front of that, it was the hiding under the gum line. The neck of the tooth, or what we call as the root of the tooth, was hiding under the gum line. Now, because the wisdom tooth came out, part of the tooth got exposed, the behind the tooth, the back of the tooth got exposed because the tooth came out. So now you have the tooth completely exposed, or either the neck of the tooth, or what we call it as the root of the tooth, got exposed, and that's what may be causing some sensitivity. But you don't have to be alarmed about the sensitivity, which is going to get better over a period of time. and you just have to talk to your dentist about the dry socket, and you should be good.
All right. I've been eating sweet candies frequently for the past 3 days, and now I'm experiencing pain on the left side of my mouth. It's hard to pinpoint the exact spot, and the pain tends to occur more at night, but not all the time. Could you help me understand why this is happening?
So when you have pain after you eat candy, particularly what happens is like you may have a cavity, either like a small cavity or like even a decent sized cavity you think that you do may not have, but you may not be able to see it, or sometimes it happens in between the teeth. We call them contact in between the teeth. So particularly if you are not able to see anything in the mouth that's kind of broken, but you may have a cavity hiding in between the teeth, and particularly if it is happening because when you eat sweet, then it is very possible the acid from the sweet is causing pain. And guess what, like when you are sleeping at night, you're not thinking a lot, and you're going to sleep and you're not doing anything. So now your mind is focusing on the pain, and that's one of the reasons why you are getting more pain at nighttime. But of course, if you pay more attention, you will start to realize that you are having the similar type of pain during the day also. My recommendation is definitely get the tooth checked out, and particularly it just not looking in the mouth may not be may not just fix the problem. When you go to the dentist, we are going to do some special x-rays to see whether you have cavities in between the teeth, the two teeth, to check the contacts to make sure that that is not something that's causing the pain. So keep it super simple, right?
Keep it
Go
super
see the
simple.
dentist. Yeah.
I've always wondered why when you have like tooth pain, it comes more at night. But now that you explained it like that, I'm like, oh, because I'm not busy and moving around thinking about other stuff.
You
So
got it.
it's like at night you just chilling, and that's when you're thinking about it the most. Oh,
You got
learn
it.
something else.
Yeah.
All right, our next question is, I'm much older than 17 and my 29th tooth grew in sideways, causing extreme pain. There doesn't seem there doesn't seem to be any space for it to grow properly. Could you advise me on what I should do?
Well, irrespective of the age, it doesn't matter how old you are. If you are a good candidate, and you can certainly get braces to move the tooth around. But if it is a tooth that is completely out of the way, either completely went inside or completely came outside, meaning, sorry, let me explain correctly. If it is towards the cheek side, or if it moved to the tongue side inside the mouth, then it is very possible you can get the tooth removed and be done with it. Um, More than likely, what we normally see as gum specialists or periodontists is when you have a tooth that is not in alignment, either it moved it to the inside towards the tongue side or towards the cheek side. What happens is, you do get gum disease around the tooth. So the first thing I would say is, before you consider braces, go see your dentist or the gum specialist to see whether you have gum disease. After you get the gum disease treated, again, you can see the orthodontist, or maybe even before you go see the gum disease, the dentist or the gum specialist, you can talk to the dentist or the orthodontist about whether you are a good candidate for braces or not. And if they do recommend, at the same time you are getting the gum treatment done, whenever you're getting numb, you can get the tooth removed at the same time. As we said earlier, one and
done.
one and done. There we go. Right? Yeah, you got it.
All
Okay.
right, we have one more live question, guys. I'm a 22-year-old male and I have a white patch in my mouth with a small dark spot. I also noticed a wart-like painless bump on my gums. My dentist said it might be due to smoking. Could you provide more insight on what this could be and if I should be concerned?
What do you think we would do when the patient comes in our office?
Biopsy?
Man, finally you got one thing right, right? So tell me what the biopsy is.
And so a biopsy is basically we just cut the gums or the tissue and we
Don't scare them. Tell them trim.
trim the
Yeah.
gums
Or trim the lesion,
the
right?
lesion, and then we will send it off to be tested and see what's going on with it.
Right, yeah. So the bottom line is, this is what we normally talk, right? So whenever patients come, a lot of times, sometimes female patients are more concerned. They are looking around, right? I always tell them, hey, let me ask you. So when you are self-examining yourself and you found a small lump on your breast, and how would you feel comfortable just leaving it alone, or you'll be going to see the doctor, right? That's exactly what we say. Whenever what we say is, hey, we do this all the time. Every time patient comes in, hey, have you found a lump or bump in your mouth? Or have you found a sore in your mouth in the last few months or the last few days? So then we immediately recommend they do something about it. So going back to the asking the female, right? So we always tell them when they find something, they are more than likely go see the doctor. The doctor may recommend doing a biopsy. That's the exact same thing. Whenever you find something abnormal, which is a growth or which is a non-healing ulcer in the mouth, we always recommend you get a biopsy done just to have the peace of mind, because you don't want to have miss anything obvious, which could be an oral cancer.
All right, good stuff. All right, it says, hello, Dr. V. How is deep cleaning different from routine cleanings?
You want to take that?
Well, deep cleaning, they go underneath the gum and remove all of the bacteria and stuff from underneath it. And a routine cleaning is more of the surface of the teeth. So we remove the plaque and the bacteria from the surface. So deep is deeper, and routine is just a regular routine cleaning.
So what do we do when we do the deep cleaning? We give them numbing.
Yeah,
right?
we numb it because you may feel a little bit of pain with the going underneath the gum line and stuff like that. So we do numb the area, so you won't be in any pain per se, but that's the difference between
Right.
the two.
So we do like a pretty much like almost like a polishing or like over the surface cleaning when we do the regular cleaning, as opposed to when you have a deep tartar or like a lot of calcium deposits on the teeth, particularly the bacterial component involved in this, and depending on the amount of bacterial component involved and the amount of disease you have, when we get you completely numb, we go all the way deep under to remove all the tartar, and we scrape all the tartar away. And also, one other thing we additionally do in our office is, what do we do? The laser,
the
right?
laser machine, yeah.
Yeah, so the laser that we do to disinfect the area and remove the bacteria. So whenever we remove the bacteria, we are leaving a better environment for your gums to heal. Your gums tend to heal a lot better as opposed to when we are not using the laser. It's still going to heal, but the efficiency and the effectiveness of the gum healing is a lot better. What we call it as a laser assisted deep gum therapy, which is what we do in our office. Yeah. So talk to your dentist, and you are a candidate for a regular cleaning or you need a deep cleaning.
Deep cleaning. All right. Hi, doctor. I've been following your live sessions for quite some time, and they've been very helpful. Sometimes I hesitate to ask certain questions directly to my dentist, so it's easier to ask them here. My question is, my dentist told me I have a grade 2 gum disease and recommended using an ointment and massaging it for 15 days. Will this help cure the disease?
Well, first of all, thank you for being a loyal follower and watching our live show, and we appreciate it very much. And when you have gum disease, whether massaging the gum with an ointment or any type of paste that you're going to be using, is that going to cure the problem? Absolutely not. Again, particularly if you have moderate to severe gum disease, and it is not going to cure the problem. And one thing kind of debatable here is, gum disease is ever curable. We always don't say, oh, we are going to completely cure it. We are always going to get it completely under control. That's what we normally say. Guess what? Like, if you are going to get it completely under control, you're as good as normal. It's kind of like somebody who has diabetes, and you may not be able to completely cure them. You're going to get it completely under control, and they are as good as any other normal patient. The same way, when you have gum disease, and when we are able to get it completely under control, and we are able to reverse the bone loss and all of that, you're as good as a normal patient. That is not a problem at all. So we should be able to help you with that. And then to answer your question, whether just the ointment alone or any type of application alone is going to not let's not talk about cure, reverse the gum disease. My recommendation is you do the massaging and you do whatever you can, but on the top of that, more than likely you are going to need some type of deep gum therapy or a laser assisted gum therapy. Again, talk to your dentist or the gum specialist in your area or the periodontist in your area. They should be able to help you.
All right. Okay, it says, I'm 47 years old. My cholesterol levels are slightly on the higher side. So my doctor has advised me to be on blood thinners. I noticed a lump on my lower lip a few months ago, but since it didn't cause any pain or discomfort, I didn't pay much attention to it. Recently, I've been experiencing numbness in my lips, so I visited a dentist. The dentist suggested a biopsy with a laser and strongly recommended against the traditional method. I want to know if this is the best advice or is there anything else I should consider. Would it be better to leave it as is without disrupting it?
Well, whenever you have a growth in your mouth or the head or neck or anywhere in your body, we would not, let you, or we would not recommend you ignore it. Definitely get it checked out. If it is in other parts of the body, go see the doctor. If it is in the mouth or the head or neck area, go see the dentist. We will be able to help you. To answer your question, would I be concerned about the lump that you have? Absolutely, I will be concerned about the lump that you have. We always recommend that you get a biopsy done. Whether you need to get a traditional biopsy done or a laser biopsy done, laser is a non-invasive form that we do. Sometimes we are able to do a laser procedure without even numbing. See, a lot of times patients are concerned about not about the procedure, they are concerned about the injection. So sometimes we may be able to apply just a little bit of topical, just like an ointment, and we lace the area out and then be done with it, right? So again, whether you are a candidate for laser procedure or you need a traditional procedure, your dentist should be able to answer that question for you. And then the biggest concern that I have from what you told me, you said like you have some numbness in on the lip or in somewhere in the mouth. So I can't tell you the reason why just by from having a lump in the mouth could be causing that. I will be more concerned about the numbness than the lump or the growth that you have, because the growth is very easy to fix, but the numbness may need some more investigation. So again, talk to the dentist or talk to the doctor to see what is the cause for the numbness. You don't want to definitely ignore any type of numbness.
Definitely don't ignore it, okay? So
You
go
got
get
it.
that checked out. All right, it says my father is 77 years old and is under medication for Parkinson's disease. He has dentures but is unable to eat comfortably with them. Is it safe to opt for denture implants at his age, considering his medical condition? If it's safe, should he stop or continue his regular medication?
So it's kind of a tricky situation here. Parkinson's disease, and depending on how controlled the Parkinson's disease is, and sometime, a lot of time, or not sometime, a lot of times, when what we see is patients with Parkinson's disease, and they have a lot of dexterity issues, meaning that they are not able to brush or floss their teeth properly. So think about this, and we always say this: patients are going to think that when they are going to get the implant done, they are thinking one and done.
One and done.
It is not a one and
It's
done.
not one and done,
You
though.
need to maintain that, right?
Yes.
So that's what I'm talking about. Although it is a one and done time procedure, you still need to, you can't say that, oh, I got implants, I can forget about not going to the dentist, right? So you can't do that. So you still need to maintain it. You need to brush and floss to keep maintaining your dental implant. So again, depending on the level of Parkinson's disease and whether your dad is able to manage like his healthy like a routine daily activities, then and your dentist or the specialist you may be going to they should be able to recommend whether your dad is a good candidate. It is not a bad option to consider what we call it as a snap-on dentures, because if something happens to the teeth, you can always, your dad can snap in the teeth, or if he's a good candidate for fixed teeth, again, talk to your dentist and they should be able to help you.
All right, guys, that's our time today. We enjoyed speaking with you and answering all your questions, me and Dr. V.
Thank you all. Thank you very much. And thank you for being loyal followers. And we look forward to seeing you next time. Thank you very much.